Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is Murray Brozinsky. He's chief strategy officer at Amwell. Welcome, Murray.
John, great to be here with you. Thank you.
Yeah, well, I think today's topic is the topic du jour, ChatGPT hitting the internet, every industry, not just healthcare. But before we dive into that, tell us a little bit about yourself and Amwell.
Sure. I joined Amwell about 18 months ago through acquisition. So Amwell acquired my company, Conversa Health, where I was CEO. And Conversa built an automated care platform. We'll talk a lot about that in conjunction with the subject today. And that's now become Amwell Automated Care. So it's a big component of our of our hybrid care platform.
Everybody wants automation as we're all burnt out. So I think this will be a good conversation. Let's dive into that topic though. What do you see as kind of the future of tools like ChatGPT? Of course, Google has Google's Bard and similar technologies. What do you see as the future of that, for healthcare, and where do you think it will have an impact?
Yeah, great question. I mean, there's so much excitement. First of all, I'm very excited about it. I think it's going to be a game changer. We've heard about AI being a game changer for a long time. And like everything else, there's a lot of hype and it doesn't really live up to its promise. I do think we're at the point where this is real, but I think it's important to, and as you framed it, to think about where it actually fits in. So we've been very deliberate in how we think about healthcare. And if you look at the big Uber trends in healthcare, quality of care has gone down over time, cost to deliver has gone up. It's been very difficult to access. And so if you really think about those fundamental kind of problems in healthcare, how do you deploy technology to address them? And that's where automation and AI really, I think, have a real big role to play, but it's really important to understand where it fits. So and I think it's helpful to understand where I'm coming from. We've built sort of an enablement platform for what we see as hybrid care. So how do you integrate digital and virtual into physical care and make it seamless and make it work for the patient and ultimately be able to deliver higher quality outcomes at a reasonable cost? We can't break the bank. We're spending 20% of GDP in the country. So that's what we've been doing. And when you think about it, it has to be purpose built. You have to think about why you're using a particular technology. How is it additive and augmenting that ultimate goal and purpose? So I think ChatGPT is super exciting, but it's core to understand what it is. So it's natural language generation, right? The ability to generate language that simulates what a human would actually do in terms of written or verbal language. And in order to do that, it needs to understand what you're saying. So natural language understanding, natural language generation. So I think it has an enormous role to play. But when you think about the heavy lift to be able to understand exactly what you're saying as a patient and to be able to deliver back what a highly trained physician or nurse or social worker might do, that's a pretty tall order. So I think the better way to think about it is, how is it going to augment, again, how we deliver care today with highly trained people? How does it help them do their job more effectively to drive better outcomes at lower cost?
Well, and I think that's the problem in healthcare is, and fair or not, I think we have this high bar, right? That is do no harm, right? Like it's literally built into the healthcare system, and for good reason. We don't want to, injure someone, and we have to be right. Otherwise, it's their life literally on the line. And so, I think that's the challenge. So is that where you see is that it needs to augment because of that high bar, as far as, I can't just automate this and then maybe, a patient loses their life. Is that why the bar is so high and it just needs to augment with a human that kind of verifies it? Or how do you see that evolving?
I think that's the starting point. So the starting point in healthcare has to be do no harm. So safety is paramount. But it doesn't stop there. I mean, I think actually, ultimately, if you're trying to improve care, the experience of care, and ultimately the health outcomes of patients, you have to think about what's the best combination of ways to do that. So to give you an example, the role of automate, there's lots of roles in healthcare for automation, but if you think about the role of automation in actual care delivery, the idea there is, how can you offload things that people are currently doing in terms of care delivery? And then the flip side of that is, how can you use automation to check in on patients and determine what the issue is of those patients, right? So how do you do some predictive modeling and understand where you, John, maybe you look good today, but based on the data I have about you, I can predict that you might decompensate tomorrow. And so how do I do an earlier intervention, right? To keep you healthier longer, it's lower cost for the system, it's good for everybody. And so what's the best way to do it? If you could completely automate and use AI and replace people, we would do that. The technology is nowhere near. It's not a matter of, oh, it'll happen in a couple of months or a couple of years. And I can talk about why. I don't think that's in the card. So I think the paradigm is less Terminator, how to use AI to eliminate people. It's more Iron Man. How do we use AI and ChatGPT and others to augment people, care delivery?
Yeah, I'd love to hear more why you don't think it will replace it. There's certainly VCs out there who like to push it, which, that's their job as VCs, is to try to invest in something that will. But, what do you think are some of those barriers to replacing a person?
Yeah, it's funny. If you play with ChatGPT, which have you spent time with it?
Yeah, definitely.
Yeah. So I've spent a lot of time with 3 and now 4. And if you actually ask it all the questions in itself, it'll talk about what it's capable of, what it's good at, what its limitations are. And I've, of course, asked those questions very specifically around healthcare. And so if you think about what you're trying to do when you automate a care path for a patient, you're trying to march them down an evidence-based pathway, right? So we know through evidence, that's how medicine works, what works and what doesn't. And so if you want to reliably have conviction around behaviors that lead to certain outcomes, it needs to be evidence-based. To get people to do it, you need to personalize, right? Because you're very different than I am, respond to different things. And so that's intention. How do I walk you down a personalized pathway, but make sure that it's evidence-based so I have the predictive power of the outcomes that I'm trying to achieve? That's a very, very specific use of technology. So I need to be able to guide you and give you a recommendation for the next best step, the step that you specifically, John, should take. Well, if you think about natural language understanding, trying to understand what you're saying, and natural language generation, trying to generate something that sounds like a human generated it, neither of those focuses for AI or what I just described as marching you down a pathway. So it has a role. And I think the role is in that paradigm where I'm trying to march you down, I'm trying to understand what you're saying, I can't make any errors whatsoever. So right now, if I'm trying to model the language of a physician, they use lots of big words, but it's very precise and it's actually fairly narrow. Natural language processing could do a really good job there. Nuance and others have been doing it for years. To try to understand what a patient is saying, what a patient can say or respond with any kind of word whatsoever, and in their mind, it might be a different meaning than, you might have a different meaning for a word you're using than I would as a patient. That's really, really a tall order for AI. No matter how good the NLP is, it's 20, 30% error rates. So right there's a problem. I'm not sure I know exactly what you said. I'm going to err on the safe side. I'm going to get you to somebody who can interpret it. So the proposition of automating falls down right there. On the natural language generation side, ChatGPT can generate stuff that sounds very much like a human, but as you know, we're reading it all the time. It can also insult people. It can give false information. So I think it needs to have a human in the loop, right? There needs to be a human that can look at that, an expert, and make the appropriate edits and changes. So if you think about what it's good at and you think about those risks and limitations, it seems to me it'll be more of a tool for highly trained healthcare professionals to use to be wildly more effective and efficient at creating the content for those pathways. So that's where I think it'll be used.
Interesting. Yeah, well, I think there's multiple elements. With the personalization makes a lot of sense, right? Because it's offering generalized responses rather than personalized responses. Although I think that will evolve quickly, which will be interesting to watch. But to your point, it's hard to make the specific recommendations that are going to be safe and unique to that individual. I see the same with in the writing that we do, right? Could it write an article about telehealth, right? Or even ChatGPT, it could write about itself, which is also a fascinating idea that we can ask it, what are you good at and what are you not, right? And it actually can answer you and tell you, right? Which is, maybe more honest than a salesperson out there, but it's interesting how that works. But but I think, it's the same for us, right? It could write an article, but the secret sauce that actually adds value, it's not good at. So, it's interesting how it's a similar thing. Are there certain areas where you'd think these tools won't have an impact? I mean, we talked about replacing them fully. That makes sense. Are there some areas where you're like, this is way off, it's not going to happen, like this tool is not good for solving this problem?
Yeah, I mean, I think, so I'll start with where I think it is really good. So for the generic case, so a patient comes in, someone is determined that it's likely to be a common problem or ailment. I think generalized education materials, and ultimately, by the way, when it gets really good, maybe you can do some of that without a human in the loop as well, right? Because again, am I too afraid of putting it in, Microsoft putting it in their search engine? No, because to your point, the risk of it being wrong is low. So there's a lot of value in it being right most of the time.
And there's a human reading the results, right?
In that case, the human reading results. So I think, I think where it falls down and where it won't be good is where you have sparse data. So it's actually also operating on it's large language model, right? So huge language that it's operating on, huge amount of data, which is the way AI works in general. It needs lots and lots of data to be trained on. Where you have sparse data, right? So you don't have a lot of examples. And that's where humans are very good. So highly trained medical professionals seeing very few data points, trying to make a decision about a treatment to save your life. That you wouldn't throw AI at that because it's not even fundamentally how it works. It really needs to operate on large data sets.
Yeah, no, that makes sense. And yeah, it's interesting. There's so much data in healthcare, but there's some areas where you're like, yeah, there's not a lot of data. And doctors deal with that every day.
Well, you hit it on the head. There's lots of data, but when you look at it, it's not about how much data is there in healthcare. It's about how much predictive data is there in the specific domain and very specifically around the variables that you're trying to predict. So that's where it becomes really important. When you start to descend, there's lots and lots of data, but when you start to look at what data do I need to predict that you're going to have lung decompensation in 30 days based on what I'm seeing today? Well, there's not a lot of data on that. And so that problem is you have to start with, well, how do I collect more, FEV1 scores from, people blowing into a puffer, and how do I get more devices out to people, collect that data, validate that data, and then you can start to run predictive models on it. Then you can start to have AI assist. I don't, again, think you'll have them making a decision and conveying it directly to the patient for a long time.
Yeah. Who do you think is going to use these tools more? Clinicians, patients? Where do you see this kind of playing out?
Yeah, I actually think, I was thinking about that. So based on what I just said, you would think it would be the clinicians, right? The providers creating, more effectively creating tools that extend their reach. So effectively what automation in healthcare is doing, and virtual for that matter, is extending the care team, the provider, the social worker, the nurse's reach 24/7. So you would think, based on what I said, they would use the tools, ChatGPT and others, to create those things. I actually don't think they will, though, because we want to keep those people practicing at the top of their license and providing care. So I think there's going to be a whole new class of job actually in healthcare, the prompt writers in the case of ChatGPT, right? People who get really good at what is the prompt? How do I work collaboratively with ChatGPT to generate highly accurate output, right? So it's doing the heavy lifting to generate, and I'm doing lightweight editing to make sure it's right. So this human in the loop, you want to make sure that it's leveraged as much as possible. And I think it's a skill. It's someone with a lot of domain experience, who has patient and consumer sort of sensibilities, and someone who really understands how the AI, ChatGPT in this case, works. And that'll become a discipline. I think we'll start to see medical and healthcare prompt writers.
Yeah, no, I think you're right. I was talking with someone about this, and they said, well, I made the comment. I was like, well, the problem with ChatGPT is it doesn't include a lot of the references for why it said what it said. And then the person replied to me, well, if you just say include references, it will. And I was like, well, to your point, this is like a trained skill to know, oh, I just need to ask it for that, and then it will, which is a different mindset, right?
I had the same experience. I got my account the first night in November when ChatGPT 3 came out, and I called my daughter, who's a freshman in college, and she's like, Dad, I forgot what she said, but it was effectively, you're so behind the times. Like I've had an hour longer than whatever it was. And exactly the same thing though. So I started playing with it, and she said, the only problem with it is for college, it doesn't have the references. And I said, well, why don't we just see? Why don't we ask it to put references? And immediately it populated it with references.
Yeah. And so, again, I mean, this goes back to our, I look at my children as well. It's like, this is just going to be a reality. They're going to have the tool. They're going to need to know how to use it so they can tell it what to do, as opposed to be told what to do by the bots. Right. So interesting. Let's expand the conversation a bit, because ChatGPT has powerful effects and related technologies. I love how you framed it: natural language processing versus natural language generation, which I think is an interesting bimodal look at what's really happening out there. But how do you see these tools fitting into what's really becoming kind of that virtual care technology stack? Amwell's put together, a really interesting stack across synchronous video, asynchronous messaging, automated assistance, which is, I'm sure, a lot of the Conversa stuff you're doing. Like, how does that all fit together, and how is it going to be packaged and deliver care, going forward? How do you see that kind of coming together?
Yeah, I think, and you described it well. It's really it's an ever expanding stack. So nothing's going to replace physical care. There'll always be a need for physical care. So and that's the highest cost care and inpatient in the hospital. So how do you make sure that you're only using that resource when necessary? So there's a lot of technology that's just trying to figure out what's the status of a patient, right? Because the default is the patient goes to the ED, right? And it's a terrible experience. It's hugely costly. They're not trained for the specific issues. They're kind of just taking inbound. So increasingly what we want to do is move from reactive to proactive, right? And a lot of that can be done by reaching out to the patients when they're in their home, having them creating a longitudinal relationship versus you see patients once a year when they come in for their wellness visits and only when they show up and there's already a problem, right? So how do you get ahead of that? So I think the big thrusts in healthcare are, one, bring the patient into the fold. So train the patients that they need to be involved in their health and they need to be involved in their care journeys when they're going through something. And it should start early, not when something's wrong. So if you're building a relationship, and Amwell's philosophy is, let's get companions in everyone's hand. That's the automated piece, right? So you start to interact with the companion, again, on behalf of your care team. So it's always coming from being prescribed by your doctor, your nurse, your social worker, whoever it might be. And that's constantly providing guidance and keeping you healthy and anything you can possibly do in an automated way. And our approach is very structured. So there's no error. If we don't understand what you're saying, then we'll escalate you and you can talk to somebody, right? So very simple way of addressing that problem. If we know what you're saying and there's an issue, then the question is, can the next step be done in an automated way? Does it require just, hey, change this behavior, we'll check in tomorrow. Here's some education to get you to do something different. And if we check in tomorrow and then you're back to, a more normal measurement, for example, on blood pressure, or your anxiety has subsided, then great. And we'll continue to help reinforce the behaviors that you've taken. If you're off track in some way, and the nudge back to being on track didn't work, then we assess, where should you go next? Should we send a notification to a care team member to call you? Do we really need to get you into a synchronous telehealth visit? Do we need to make an in-person appointment? Is it an emergency? All that sort of stuff can be done in an automated way. And that's how automation interfaces with virtual. There's a lot of things that can be done just with video or asynchronous texting. And then if you need to have the physical, right, then it can navigate you to physical. So we're using all of those different layers to provide actual care, right? It's providing interventions and then assessing, surveilling all the time when you need that higher level of care. I think where ChatGPT, for example, fits in, as we were just talking about, is all of those interactions require me to take information from you and provide guidance and education information back to you. And to the extent that we can use ChatGPT and others to automate that in real time, it's much more efficient. It can be very, very effective so long as we're comfortable that what it's taking in is understood appropriately and what it's providing back is appropriate guidance. And that's where I think having the human in the loop is going to always be important.
Yeah. The other area, I don't know if you guys have explored this, is, okay, now you've had these interactions and exchanges. How do you summarize that to the doctor? Right? Like, because the doctor doesn't want to go read all that. If there's been, 50 messages discussing and describing, and did you want to go to urgent care? Did you not? Did you, I think that's where it's interesting as well, is taking this long narrative into something short for the doctor to understand what's happened.
Well, that's a really good point too. So there have been technologies before ChatGPT, Narrative, RX, and others that do just that, and this takes it to the next level. So the ability to take either lots of transcript information, like you're saying, and summarize. The flip side too, being able to actually take data points and turn it into a narrative so that it's more easily understood by a care team. So one of these technologies I looked at a while ago started out doing it took statistics from baseball. So it started with little league teams. It would take all the stats that are recorded and it would turn them into pretty compelling news stories. And so you can see that happening in healthcare. And then we haven't even talked about the administrative side. So the administrative side, where there's very low risk, I see plugging in ChatGPT, just like we've had, customer service reps being automated through chatbots for a long time. I think that whole thing could be automated using this technology.
The billing side is safer in some ways.
As
long as it doesn't disrupt your bottom line, because it has some error. It's a different issue.
Well, the important thing is there's less of a risk because it's money, not lives, but it's also reversible, right? It can be corrected.
Right. Exactly. That's an interesting point. Good point. So, as we wrap up, I'd love to hear this kind of broad question. Do you think ChatGPT is going to disrupt healthcare as we know it?
Yeah, I mean, based on everything I just said, the answer is yes. And as I said, I don't think it's going to be able to replace, this Terminator thing, with one caveat, which is we're very bad at predicting the future of technology. We everything we do when we predict and forecast, no matter how smart we are, is linear, and technologies, especially AI technologies, tend to be very nonlinear. So I think if we're sitting here today thinking it's going to be disruptive, I think it's going to be disruptive. The other side, though, is we usually overestimate technology's ability in the short term and underestimate it in the long term. And I think this is no different. The hype on this stuff is so high, and the ability to regulate and understand and make it not a black box is so lagging that we're going to have a few missteps and it's going to slow things down. But I think in the long term, it's going to be enormously disruptive. But I think in the short term, it's going to be similar to self-driving cars, right? You have one accident and people say we shouldn't have self-driving cars. They're comparing it to zero. The accidents being 1 million people die on the road for human error each year. That's the bar. I think we need to get to that point to start evaluating and catching up and understanding how to regulate this kind of a technology. But I think long-term, hugely disruptive. Short-term, we're going to be sitting here in 6 months or a year and say that thing was overhyped.
Yeah, that's a good point. We've seen that a lot with a lot of companies and investments as well. That it's a similar concept. I would describe it as how it's going to be disruptive is what's going to be interesting, because is it going to disrupt the $3 trillion industry? No, it's still going to be a $3 trillion industry. But how care is provided, how patients want to be interacted with, that's where it's going to disrupt it. So, anyway, it's a slight nuance of what you said, I think, which is it's going to disrupt the experience for doctors, for patients, and how they deliver care, but maybe not disrupt the industry itself.
I think that's right. Actually, we're over 4 trillion now, unfortunately. But I think you're exactly right. I think it's going to disrupt. There's a lot of content in healthcare that's created, and I think it's going to disrupt that. I do think it's going to be, as I was saying, at least for the foreseeable future, it's going to find its place as a tool. And so it's not going to be, I think there'll be lots of places where ChatGPT will be visible to consumers, like in search engines. I think that's the Wild West. And I think there'll be a lot of, like we see today, direct interaction. I think in healthcare, it'll recede, and it'll be used as a tool behind the scenes to generate better content more effectively, much more coverage, more revisions and updates. But I don't think ultimately that patients for the foreseeable future will be interacting directly with those technologies.
Yeah. Well, and I'm amazed with what the patients are doing. All those letters to doctors that they, basically, if it feels like Groundhog Day, you should probably use ChatGPT to do it. And that's what all those things are for patients.
That's not a bad guide, actually, right? If it's something that's totally repetitive, low risk, yeah, that's a very easy place to see it.
Yeah. Excellent. Well, Murray, I appreciate you taking the time to talk about this important topic. I think it's going to be fun to watch. I've compared it to, back in the day when cell phones, smartphones really came onto the market. It was just exciting because there was all this potential. And the same was true with social media. And you had to learn, well, how are we going to use this to connect and do it? I feel like that same energy with ChatGPT and AI right now.
Yeah, totally agree with you. And we don't see that all that often. So it's real. I mean, the fact of the matter is the fact that people think it's important. It is important. People are spending lots of time. It's companies being built on it. It's exciting. So yeah, excited to talk to you about it, and really, really pleasure to spend the hour with you today.
Great. Well, thanks, Murray. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Murray.
Thanks, John.